Good afternoon, dear colleagues. It's my great pleasure to introduce Sonja Wehsely to you, at least to those of you who are from Vienna. There is no necessity to introduce her because she has been a very prominent regional politician for quite some time. Between 2004 and 2017, Sonja Wehsely was a member of the Regional Council of the Regional Government here in Vienna. She was responsible for health and social affairs, women's affairs, consumer protection, and human resources. But after that part of her CV, she moved into private practice, into industry, and she is currently Executive Vice President and Managing Director for Central Eastern Europe and Central Asia at Siemens Healthineers. This is a very interesting company. Let me just share very briefly the website. She is a lawyer by training, as I want to also, that's also important for this podcast, obviously. And I had the privilege to meet her for the first time some weeks ago at a conference about artificial intelligence and health and law here in Vienna. And she was so kind to accept my invitation right after that. Sonja Wehsely, so great to have you here. We agreed on that you would introduce what you are currently doing by yourself. You prepared some slides for this, and I may kindly ask you to continue with this by this very minute. Please, you have the floor.
So thanks a lot. Thanks a lot for having me. And I'm very much looking forward to our, for sure, interesting conversation. Just a few informations about Siemens Healthineers. So Siemens Healthineers, our theme is why we pioneer breakthroughs in healthcare for everyone, everywhere, sustainably. And if you move to the next slide, that gives a quite good overview who we are. So we are a global market leader in vitro, in vivo, and imaging guided therapies globally. We have legal entities in more than 70 countries, more than 70,000 employees within Siemens Healthineers. Our revenue is more than 20 billion. And that's, I think, also very important to our today's discussion. 90% of all leading hospitals globally collaborate with us. And for diagnosis, our portfolio is really very relevant. So more than 70% of all clinical decisions are influenced by the type of technology we provide. We have an installed base of more than 700,000 units globally. And that's very important, also related to our today's conversation. So it's company policy that we invest more than 10% of our yearly revenue in R&D. So that's an important number of investment, and we have currently 84 AI supported product offerings in the market, so with CE labeled. And the triangle you see in the middle, that's what it is about. That's what we want to support, and we see the future of healthcare delivery in patient twinning. So means to support healthcare providers, healthcare experts in being more relevant and being more accurate in predicting patient pathways. Precision medicine, so precision medicine is becoming more and more personalized, and that all relates and comes together with digital data and artificial intelligence, which only make that possible. So that's what we are, and therefore we are, of course, very, very impacted, and the legislation on artificial intelligence and data and is very relevant for us, but also for our customers.
Okay, thank you very much for this introduction. Let me therefore start very easily in the sense of how do you perceive, as a lawyer by training, what's going on in Europe at the moment on a personal level, but also on a professional level when it comes to regulation of digitalization and data, in particular in the health sector?
So first of all, personally, but also as representing my company, I want to start with that. I think it's a very, very ambitious goal of European Union to tackle these topics, and to focus on how to deal with it. What I still think is an open topic is how all that relates together. I just had a view on what are we really talking about, and if you start with the GDPR, which I think is in place since 2018, now we already have a kind of a practice how to deal with it. But the Data Act, the NIS2, the Cyber Resilience Act, the Data Governance Act, the Digital Market Act, the e-privacy regulations, and now the Artificial Intelligence Act, of course, makes it very difficult to keep the overview of what's going on.
Mm-hmm. Mm-hmm. And how do you do this? I mean, personally and as a company?
Well,
how do you keep the overview?
I'm not so sure if anyone really has the overview, to be very, very blunt on that, because we see more and more, and I try to really understand what the AI Act is about, and how the Data Act is related to the European health data space, which is, of course, very, very important to the topics I have referred before. So precision medicine and patient twinning. And what we see more and more is that there are regulations which are contradictory in a way. So, for example, the AI Act, and I think it's important to regulate artificial intelligence, but we see that the AI Act is partially contradictory and double regulation compared with the MDR and the IVDR. So there you have on one hand verticalized rules, and on the other hand horizontal regulation, which creates gaps, which creates double work, and which has to be figured out. And I think a big issue, and all started with GDPR, is that it's not really clear on one hand how quick the notified bodies will be out there and will be really able to work, and how quick you will have a really good quality on results to know what is needed and was not, because the text of the act is not in a way that you really know what's needed and what's not needed, from my point of view.
Mm-hmm. So you are, if I get you correctly, what you're stating at the moment is that when it comes to the implementation of the AI Act, it's important to be fast, and let's see how the implementation in the different member states will look like. Austria, as you certainly know, at least the State Secretary for Digitalization, the former State Secretary for Digitalization, as I need to say now, Mr. Turski, was constantly and at various occasions emphasizing that Austria would be one of the earliest adopters of the AI Act and the AI policy coming with the European Act on AI. Well, do you already see an outcome of this approach in your daily experience with AI regulation? And if so, how does that look like?
Well, honestly, I think that's too early. What's really what's the challenging thing currently? We have 84 approved AI-powered medical devices in the market, out of our portfolio. And the MDR and the IVDR, we could discuss hours about it, and we also could discuss that currently it takes 12 to 18 months for a CE label, so it's much longer than it was before, and it's I would say 10 times more expensive to penetrate the European market, which, to be honest, it's maybe not so much a topic for Siemens Healthineers, but for smaller medtech companies, it's about to think, should we really penetrate the European market, or is it easier in South Korea or even in the US? Yeah. But the issue is now, how does this vertical legislation fit to the horizontal AI Act? And there, honestly, I have the feeling that the quality of the legislation is worsening, because there is almost each and every day a new trialogue result or so, but there are a lot of open questions. But the issue is how to deal with it. And I think that's an issue not only for industry, it's also an issue for the notified bodies. And the notified bodies are again an issue for the countries, because there are so many different notified bodies now needed, that even the question how the legislation will be brought in reality is not easy to streamline also for the countries.
So what you're describing at the moment, if I understand you correctly, is that already now, prior to the AI Act, there is a lot of regulatory red tape for companies like yours. And one of the issues is not only the regulatory red tape, but also the different interpretation of this red tape by different authorities within a country, and then even more importantly, when you come into different countries.
Yeah.
And did I understand you correctly that this is already an issue for Siemens Healthineers, in the sense of that you might consider whether something is worth being put on the European market?
So
or is it
not for
more
us.
that it's just a kind of an annoying factor that is mainly important for smaller companies?
I think that's what you're describing is more an issue for smaller companies. But what we of course see, that it takes much longer to penetrate European market than other markets. And of course, Siemens Healthineers is a publicly listed company in Frankfurt, publicly listed company, but coming from Europe, of course, the European market is very, very important to us. And there it's also about how is our competition outside Europe doing? And that's what I think is an important topic as well, beside all the topics regarding our customers and the patients. And at the end, we always, from my point of view, should think about why are we doing all that? Yeah. And the regulations and the portfolio, it's about to support healthcare delivery in a better way, to increase healthcare access in regions of the world where healthcare access is not possible now. So there, artificial intelligence can really make the difference. We also see globally that the number of healthcare workers is not stable, is decreasing, while on the other hand, very threatening diseases, so for example, cancer, is increasing. So we have currently about 18 million people diagnosed with cancer every year. And the prediction for 2040 is that 30 million people will be diagnosed. In parallel, you have the issue of the shortage of healthcare workers. So one solution, not the one and only, but one solution is to use AI as an additional pair of eyes for diagnosis. And that has to be organized. Has to be organized from a legal standpoint, from an industry standpoint, and from a customer standpoint.
Yeah. Let me just bring in two standpoints that the European Commission most likely would bring in if I had asked a member of the Commission to join us here. The first point they would probably make would be it's important that patients are properly protected, and that requires clear rules. And those clear rules now finally are in the AI Act. And secondly, more importantly, perhaps they would also argue that regulation and regulatory clearness are advantages on the market, not disadvantages, because it's better than and easier for companies such as yours to to adapt to what is required, so that Europe is on the forefront of strengthening AI in the field. May I ask you to comment on both statements?
So that's what Brito says, and what's on one hand theoretically is absolutely right, and I would underline it. On the other hand, especially in the medtech regulation, we see out of this AI Act, in combination with the already existing MDR and IVDR as a vectorial legislation, we see conflicting requirements, and we see parallel conformity assessments, parallel quality management needs and systems, parallel risk management systems, parallel reporting in a little bit slightly a different way. And the challenges with these two regulations is the capacity of the notified bodies. Mm-hmm. And therefore, in theory, I even do not want to say we should not have it, but I would say, and I think I can understand and imagine why this AI Act is a horizontal legislation. From a content perspective, it would have been much more useful for the patient, for the customer, and also for the goals the European Commission and the European Parliament gave themselves to add maybe needed pieces in the MDR and in the IVDR regarding regulations for medical equipment, and not to create this, how to say, from a marketing standpoint, very big thing, but not solving problems, but in our case, really creating additional problems.
Mm-hmm. Did you bring this argument during the legislation process? And if so, why was it not heard, or was it heard and implemented somewhere, or how would you describe this?
So, well, of course, we brought it in, and we did not bring it in only as Siemens Healthineers, but the COTSIA and other medtech associations brought it in. So the status is now that there is a kind of a promise of the EU Commission for guidelines, but guidelines, as we know as lawyers, guidelines are not binding. And I think what's a little bit underestimated is the number of stakeholders who are in there. Yeah. Mm. So therefore, I'm always optimistic. So I hope we can manage it. So there's quite some time to go. But again, currently with the MDR, and it was not an easy birth. So it took years, and now we know how to deal with it. And if I say we, industry, and also the notified bodies, but it takes 18 to 24 months for bringing new products on the European Union market, and the cost increased by 10 if you compare it to the time before the MDR, and now it's getting more complicated than before. And I think that's not needed. It could have been solved differently with not losing the goal the AI Act has.
Mm-hmm. And as you rightly stated, it was not really easy to get the MDR through either, right? So that was very contested, and it took quite some time, and it's not that old yet, right? So for those of you who watch this, here is the regulation. It's 2017-745 about medical devices. So that's rather recent. And now the new act is coming on top of the implementation and the implementation issues coming with this regulation. Mm-hmm. And you are stating now, if I got that correctly, it's 10 times more expensive, and also the time frame has significantly grown, right? So okay.
And what we also see in several countries, that to create the notified bodies is not so easy. So, for example, in Italy, they think about an additional tax for industry, and I'm not now talking about taxing for industry, it's a different topic, yeah. But that industry should be taxed to cover the costs of the notified bodies, and that's of course, yeah. If we all sit in the same boat, and I think it's good with Europe to make clear regulations on artificial intelligence, knowing there are risks but also opportunities. But we should do it in a meaningful way, and not, for me, it's too much marketing and too much not really hard facts.
And how would you change the system? What would you suggest then, how to make this less marketing and more reliable regulation?
Honestly, that's, as you know, I was a politician, therefore it's always easy to sit here and say, ha ha ha, that would be very easy. It's absolutely not easy, because the needs are completely different. And what I think, let's look back at GDPR. GDPR is from 2018, if I have it right in mind, yeah. And if you now look how GDPR is in reality in Austria and compare it, for example, with Ireland, it seems to be completely different worlds. And the GDPR and how the GDPR is structured, that's kind of the nucleus for all the other rules. And that's what, of course, makes it difficult. And because I was a politician, I understand absolutely why they do not want to open the GDPR, because it's like Büchse der Pandora. Yeah. On the other hand, you get out of this a lot of issues. And on the other hand is that this big number of regulations related to digital artificial intelligence, they are contradictory in itself. And I think, and I was never in lawmaking in the European Union, but I think it maybe needs more time, because if you just now look back the last 6 months, yeah, there is the Services Act, there is the Data Act, there's the European Health Space. So it's not out now, but the trilogue is finished. So the NIS2 directive is also not new, but will come into place in October this year. I think neither industry nor customers know exactly what to do and how to deal with, and that makes it difficult and does not really help in the trust of these regulations. And I think that's now a content point. Artificial intelligence, use of artificial intelligence, and trust is, from an ethical standpoint, very, very closely related.
Yeah, I mean, this is one of the points that are constantly made when it comes to AI regulation, that it's so important to constitute and to guarantee that people trust into the systems. But before they trust into the systems, they need to trust into the lawmaking. And I would again ask you, from your perspective as a former politician, you said now that we would need more time to make the quality better. Is there anything else which could be done better in setting up the rules, how all those laws are made, that would guarantee a better and trustworthy environment, and also from a legal point of view? And last not least, I mean, the argument that you state that the GDPR is somehow the thing one shouldn't open because would open then Pandora's box, is completely contradictory to the official statements about GDPR, which is, this is a success, it's an example, the world tries to copy GDPR. So that doesn't cause any trust either, does it? I mean...
Well, what I wanted to express, so it's not my opinion on that I would not open it as now in my role as a politician. Yeah, if I still was a politician, I would not open it, because and it's much easier in a city or in a country to make laws than in European Union, and therefore I want to underline it, because really it's always easy to say, well, that's really bullshit, that it could easily be done much better, because there is a lot of different views in the member states, and there is a different views, of course, also in industry. And honestly, I think with a lot of these AI topics, and I absolutely understand that the main focus and the main thinking was not how can we guarantee that on one hand, artificial intelligence as a software in medtech is uniformly defined. How can we define that human health is, of course, the place where we need highest demands on trust, on integrity, and on benefits? And what are therefore the guiding principles? The focus has been, of course, the big tech companies, yeah, and I'm absolutely not against it. But with this horizontal approach, I think you cannot cover everything. Therefore, if I just keep my part of the industry I'm responsible for, that's the medtech, I think the MDR is a regulation you could have put on additional topics if that would be needed. And that would have been much better and much easier.
And do you have an explanation why this was not taken, this approach? Why instead of this horizontal idea? Is this only about marketing, or is it about a legitimate idea of consumer safety and security?
I think in the result, I'm sure that would be the arguments from Commission and also from Parliament why that's needed. Yeah, I think that in reality does not bring more safety and more trust. But I understand. I don't have this view, but I understand where the Commission comes from. The Commission, I assume, they come from, if we take one piece out, then everyone comes and wants to have the verticalization of its regulation. And there, of course, I'm focused on medtech, and we also do not have other fields in the industry place where we have MDRs. And that was a long discussion. Therefore, I really think that's a chance we have not really used. But there are, of course, also other parts now in this new legislation. Let me maybe some sentences regarding the Data Act. Yeah, the Data Act. There maybe you can explain to me, because I'm a lawyer by training, but did not work in this field for a long time. There, I really don't get how this. On one hand, the intellectual property topics are in a way fighting with data use and data protection. And from my point of view, but it could be that I did not dig in deeply enough, that's not really clear how to deal with that in reality.
Yeah, I can agree with you. I mean, I have been trying to understand the Data Act also for quite some time. For those of you who watch this, here is the act, and just as an impression about the length of the text, right? So this is all Data Act. It's not a simple question to answer in how far this is to be put into a harmonized relation with intellectual property rules, because of course, I had a very interesting conversation here, by the way, with a professor from Germany not too long ago, Martin Schmidt-Kessel, who is writing the very first commentary on the Data Act. And of course, I'm of the opinion that some of the intellectual property rules in the Data Act are not really in line with the traditions of intellectual property law so far. And already the very first idea that it should be the user who should be in control of the data is probably not really in line with traditional understandings of European copyright law. So I completely agree with you. It's not about your non-daily legal work that you're doing at the moment. It's about the fundamental problems within the different pieces of legislation. But I would come back, if I may, I would like to come back to one point that you made, that from the Commission's point of view, if an industry were successful in arguing that they need a vertical approach instead of a horizontal one, then all the industries would come with a similar idea. I would like to ask you, well, where is the risk? Because this is quite exactly what the US are doing, and it's also quite exactly what China is doing. Both areas deal with a vertical approach instead of a horizontal one. So where is the argument that the horizontal one is the only one that is reliable, right? So
honestly, at the end, you are again in the marketing thing, and the European Union is the only one who does it, and da 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 da. And again, from a politician point of view, I know where they are coming from and why, but in reality, it creates issues, and that's what's really my main concern. Because honestly, if it's more cumbersome and da 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 da, yes, that's an issue, and but industry would have to deal with it. But we are now really in a situation, because AI in medicine, we are not in a state now where we say, let's see if AI will come or not. AI is here, and AI is here to stay. So that's how it is. Yeah. And AI combined with what what we all have seen, what's possible during COVID, where without COVID, nobody would have expected how healthcare can transform in a very, very short notice time. The impact of artificial intelligence in healthcare is now only the beginning, and there will be dramatic changes in automation of processes, in diagnosis and treatments, in patient follow-up, but also to shift. And I think that's the main topic, to shift medical institutions and care delivery from taking care and covering the sick to proactively caring for the well. And there is screening and all these topics, which only will be possible in a broad way. And I'm not talking about Austria or Germany. I'm talking globally, but also in Europe, there are not so rich parts, as we all know. And that's only possible if we use this additional two eyes from artificial intelligence, which frees up time of doctors and healthcare workers, and supports. So I always only see the artificial intelligence as support, but it has to be used, and it's beside the technology, change management within the hospital chains, within the healthcare systems, and that takes time. And the question is, do we want to be part of the solution, or do we want to be part of the problem? And in my entire life, I always want to be part of the solution, and therefore, that does not make it easier how it's currently.
Yeah, let's talk a little bit, perhaps, because you stated that before, that you are stock listed in Frankfurt and that you have European roots. Let's talk a little bit about the competitiveness of European players in the game, already before the AI Act now comes into force. So how good is Europe when you compare it with the US or with the Asian market when it comes to medical devices and the sectors, the market sectors Siemens is in? Is Europe still competitive here, or is it just like in many other areas of AI where we see quite heavy impact from non-European companies entering European markets?
Well, I would like to state two tracks. So one track is about, and I talked about it, that due to the MDR, it's more expensive and it takes a long time. But on the other hand, okay, then you have the C label, and then it's good, and that you can work with that. So that's not really an issue for us, Siemens Healthineers. As mentioned, for smaller companies, I'm sure that this is an issue. On the other hand, I think, and now we also come to an ethical questions. If we agree on that AI is here to stay and that it's not about we can decide will AI also used in medtech or not, it's about how to organize it. And there of course, and that's one of what we have 10 guiding principles for AI in medtech created in our company. And one of them is that we only work with world-class clinicians together with our R&D experts to provide that. And that, of course, we also need the entire population to create algorithms. And now you can say on the one hand, of course, we use it from all the continents, but if you would ask me if it's the same to do it in the US or in Europe, it's not the same. And I think it's important also due to ethical discussions which have to be focused on in artificial intelligence in principle, but also especially in healthcare, to have a focus on European people being part of developing AI. I think that's an important topic for the results of algorithms, but also for the competition and the way how relevant Europe is seen in this field of industry.
Mm-hmm. And what would help then, apart from better regulation? What else would be needed?
Well, I think, and that's also not, there is a lot of open topics in the European health data space, because there is this not so clear, so data use versus intellectual property. Where does it start? Mm-hmm. Where does it end? But I think that's an important, and I think nobody knows what's exactly now the outcome of the trilogue, yeah? But let's see what comes out there. And I think that's an could be an important step for European industry to really be more and more a player and not only or not be so much related on data from the US.
Mm-hmm. It's interesting that you are representing one of the major European companies in the field, that you are stating nobody knows what's coming out at the trilogue, so that it's not only academics not knowing about what's coming out, but also the industry doesn't know either, right? Isn't that a little bit strange? I mean, is this...
I would say,
is there a transparency problem behind that?
No, I would say yes and no. If I say it as industry, of course, I say it's absolutely strange. If I would see it as politician from my first life, yeah, I would say, okay, industry is not part of the trialogue, and therefore they will see the results. What I see now is that it would, of course, make much more sense if we work closer together, because then the results would be much more feasible, and we would not need so many circles. Yeah, I think currently is really the issue with all the legislations that they should be put out before the elections, and I understand why, but that does not make the quality higher.
Mm-hmm. No, I didn't argue that industry should be part of the trilogue. I try to argue that the legislative process should be more transparent than it is at the moment, right?
Yeah, you are right.
Yeah. So my statement here is that all of us are reading, I don't know, blogs and LinkedIn entries and whatever to find leaked versions of acts in order to be up to date, instead of reading it somewhere officially or following officially the trilogue. And that's in a way weird. I think at least it's weird. There's one question which is not very closely related to what we are talking about, but still I would like to take it in from the audience. I try to translate this on the spot. How do you see artificial intelligence when it comes to risk assessment for Social Security, in particular when it comes to risk-aware payment systems or risk-related payment systems? So this is perhaps a more general question, which is about how to deal with the risks coming with those technologies, and how to deal with the patients' concerns about risks coming with those technologies?
I think that's a very good question, which I will not answer now, because I'm now, especially currently, not an expert on Krankenkassen systems,
Yeah.
but
But we can
healthcare
do it more
insurance
generally,
systems.
right? It's
But
about bringing
yeah,
in the
exactly.
patient perspective, right?
But absolutely, what I think is so important, and we discussed a little bit about trust related to how important trust is regarding artificial intelligence. So I think the discussion in society should be much more in a direction in which field do we want, as a society, do we want to use artificial intelligence, and where do we not want to use artificial intelligence? So, for example, now one thing is clearish, let me say it like this, what's not allowed due to the AI Data Act. On the other hand, and I think that's also the important things for the secondary use, or even for if patients are asked if the data may be used in which field ever, it has to be very clear specified what's the use of the data. And if I give my data for scientific algorithms for universities who work together with industry, then that's one thing. But I have to be sure as a patient that my data will not be sent to insurances to create a risk assessment, to create new business models for their insurance. And I think that's a really important thing. And what, from my point of view, that this discussion in society, and I know there is a lot of discussion in science, but it's also very, very siloed. So what we would need is here a horizontal ethical discussion. What do we want to use AI for? Because at the end, it should be a decision of a society, and it should not be developed by chance where it is in and where not. And I think we don't have this discussion.
And what would be the right arena for this discussion? Would it be the national parliaments? Would it be the European Parliament? Would it be stakeholder dialogues? Would it be industry bringing in patients' perspectives? Would it be ethics committees, or is it a mixture of some or all of those?
I think, and that's not a very satisfying answer, but I think it's a mixture of all of this. I have always looked very with big eyes to discussions in the Nordics regarding HTA, so health technology assessment questions, which you never would have been able to discuss in Austria in a such, or I was not able to discuss it in a such meaningful and not emotional way. So I think we need cross competence and also cross stakeholder events to discuss it. And at the end, from my perspective, but that's how I want to see the world, it's of course the parliaments, and especially the European Parliament, because that's the broadest we have in Europe, and therefore that should also be the kind of place for discussion. But we always have to have in mind that that's of course different countries with different cultures and different interests.
Yeah, not all of them. I mean, one of the problems then is also that they need to cover everything, right? And not only medical device regulation or AI regulation, and it's a very complicated topic. So expertise is probably also an issue, right? So how to make people and politicians sufficiently proficient in what they need to regulate. Yeah, which is a problem. So last question from my side, if I may, Mrs. Wehsely, would be in how far is Siemens now trying to steer or to help or to to support the implementation process of the AI Act in the different member states? Do you have any specific plans here, or are you mainly waiting for the regulators to come?
So what we are pushing is this not binding, but by the Commission promised guidance how MDR and AI Act will fit together. I think that's the really important next step for us, and then to get an overview and see how the countries, because that's nothing industry can do, but to see how the countries are going to implement the notified bodies, and wherever we can speak up and say that's important for the patients, that's important for the economical place Europe, and therefore we have to find a good solution. And it's not, once again, it's not about being against artificial intelligence regulations, absolutely not, but it has to be in a smart way. And unfortunately, especially regarding medtech, this smart way was not brought into reality with the AI Act.
Yeah, which is perhaps good news for some of our listeners who are still studying law. So there is plenty of need for better and smarter regulation. And it's an opportunity for those of you who are interested in this. Sonja Wehsely, thank you so much for your time. I really appreciated this. It brought a lot of background information from a former politician and now from an industry perspective. Thank you so much. Thank you to all of you who listened to this. I hope that we stay connected. I hope that you stay interested. And in particular, I hope that all of us stay as healthy as possible or become as healthy as possible in the very near future. Take care and bye-bye. See you. Bye-bye.
Thanks for having us.